Good morning, everyone, and welcome to the HealthChain webinar focused on the expression of interest to become a lead SME, as we have called it. It is really to become a partner of the HealthChain project. My name is Miriam Martin. I'm head of the TIC Biomed project unit, and I'll be moderating the session today. We have now 20 participants and counting, and we have 40 participants registered. So we are very happy to have raised such an interest on this activity. And we expect to know more from your side, which are your still questions and where we can provide further information. So in this webinar, we are going to provide information about what HealthChain is about. Also, what is the process to provide or to send this expression of interest? And finally, some detailed information on the challenges that we are asking you to work on. There's also going to be some particular webinars on each of the challenges at a regional level, but we will also provide this information during the webinar. The webinar will be recorded, so you can go back to the webinar and also to the questions that have been put in place during it. So for the speakers, we are going to count with HealthChain partners, and they will provide information on the different topics that I mentioned before. So just some housekeeping rules. So as I said, the webinar, it is going to be recorded. The session, it will be available on our website, on the HealthChain website. All micros will be muted during the webinar, and but if you want to put a question, you can either write it on the question chat box, or you can raise your hand and we can open your micro. Please wait for the questions until we provide the presentations, because maybe, or listen to the questions that might be done before yours, because maybe some questions will be answered before. So the webinar is going to be structured in these 3 sections. So first of all, we are going to deliver a presentation on the HealthChain project, what we aim to achieve with HealthChain. Also, there is going to be following a presentation on the expression of interest, which is the process, what we are looking for, and which is the profile of the organizations that we are looking for. And also there's going to be a presentation of the 10 challenges that we are already selected, 2 challenges per region. And the healthcare organizations responsible of these challenges are going to present it. So with no more further ado, because we are going to have a tight program, I'm going to leave the floor to Elena Lopez, and she's going to deliver the presentation on the HealthChain project. So Elena, the floor is yours.
Thank you very much, Miriam, and good morning, everyone. Thank you for joining us. My name is Elena Lopez. I work as a project manager at TIC Biomed in Miriam's unit, and I'll be presenting the project as part of the coordinating team in HealthChain. Next slide, please. So HealthChain is an European project. It's funded through the I3 instrument. And the idea, the aim that we have for the project is to bring the presentation, it's fine, is to bring together the public and private sectors in the regional ecosystems and to help those regional ecosystems to develop by applying demand-driven approaches in order to develop digital solutions that are fitting best the needs of the end users and potential customers, which are the healthcare organizations at the end of the day. Next slide, please. So this I3 program stands for Interregional Innovation Investments. It has these 3 dimensions and aims to develop value chains, especially in less developed regions. Next slide, please. So how are these 3 dimensions covered by HealthChain? So first one, on the innovation component, we have the digital health solutions being developed in each of the regions, but we also have the project itself. As I was saying, we are looking forward to applying more demand-driven and co-creative process in the regions than what is now the standard practice, because we believe that that will translate in benefits for all the different stakeholders. First, it will increase the capacity of the healthcare organizations to innovate. Second, it will improve the delivery of the healthcare services for patients and also for the healthcare professionals who are those who perform them. Third, it will result in digital solutions with a higher success rate because they've been developed side by side with the end user and potential customer. This will help to increase the competitiveness of the EU companies developing that solutions because they will have stronger solutions, and therefore we will be able to commercialize them easily and in a faster way than compared to other technology push approaches. Next slide, please. So when it comes to the inter-regional part, it's important to mention that we have 5 regions at the moment. In total, we're 20 partners. Those regions are the ones that are currently looking for SMEs in the expression of interest. These are East Netherlands, Primorsko-Goranska in Croatia, Centro in Portugal, Murcia in Spain, and Western Slovenia. And all of them are working regionally, but also exchanging knowledge and resources across regions. So that's why we are so much focused on the interregional component. It's important to mention also that in each of the regions, we have 3 different roles. First is the healthcare organization, that is a national or a regional authority when it comes to healthcare, or a hospital that has the role of challenge identifier. They have a problem that they need to solve thanks to innovation. Then we have the IT companies with the role of challenge solver that need to co-create a solution with the healthcare organization. And finally, we have the ecosystem supporter who is providing business support to the IT companies in order to scale up and also leads the connection between different regions for this exchange of knowledge and best practice. Next slide, please. Finally, we have the investment component. So thanks to this developed value chains locally and with this connection with other regions at the cross-border level, we hope to attract more private and public investment in each of the regions and improve the efficiency of the funding that is currently available, because the ecosystem will work more closely. And that's it. That's HealthChain in a nutshell. I hope to be able to answer your questions later on. And now I leave you with my colleagues to explain in detail the expression of interest.
Thank you very much, Elena. In a nutshell, just summarizing, HealthChain is a project focused on innovation with a demand-driven approach, but also paying special attention to the interregional component. So we really want to exchange knowledge in between the different regions that are part of the project. And what we want is to leverage the existing funding, like finding out the synergies. So just to keep that in mind, because that is relevant when it comes to understand what we're doing in HealthChain. Now we are going to focus on the expression of interest. That is the topic of the webinar. And I leave the floor to Maria Bernabe. So when you are ready.
Hi, good morning, everybody. Thank you very much to my colleagues, Miriam and Elena, for this insightful introduction of the HealthChain project. So the key topic that we will be addressing today, as you know, is the expression of interest. So this is the funding opportunity we have open now in the HealthChain project. And next, please, Miriam. And we are looking for SMEs that will be selected to solve the challenges that the healthcare organization within the consortium have proposed. This is why each of the regional healthcare organization has identified 2 challenges after an unmet identification process within their hospital. And now each of these challenge should be jointly co-created by a team of 2 SMEs. So in our first stage, so we are now in the first stage of the process. So this is why we are looking for a leading SMEs that will be selected through this expression of interest. So this is this SME will be the SME leading the co-creation process, and this is why they will become part of the HealthChain project. So they will be grant beneficiaries of the project. So then, in a later stage, in a second stage of the projects, we will have to recruit and award a follower SME to co-create the solution with the leading SME. So this will be due through the financial support for third parties call. So we will launch an FSTP call afterwards to select the second SME. At the end, we will have 8 healthcare organizations jointly co-creating this solution with the selected 2 SMEs. So the healthcare organization will make a team with the 2 selected SMEs from the different stages. Next, please. In terms of benefits to become a leading SME, so if you will be selected as a leading SME in the HealthChain project, you will have the opportunity to co-create and pilot a digital solution for the challenge proposed by the healthcare organization in your country. In addition, you will receive business support from the project partners and from the 5 ecosystem supporters from the different countries and other experts within the consortium, with other IT companies with expert in business support, markets intelligence, and so on. Then you will get funding up to 81,320 euros. So this will be explained in deep in later on in the slide devoted to the budget. But you have taken into account that you will be reimbursed by the European Commission the 60% of this budget. We will address this point later. And also you will have the chance to network with other SMEs at European level and explore opportunities and find synergies for future projects. Next. When it comes to the responsibilities of leading SME, you will, as I mentioned before, you will become partner of HealthChain. So this means that you will sign the grant agreement with the HealthChain project and enter the project. So this will be done in February, between February and March 2024. So after the selection of the then SMEs. So then, once you will become partner, you will have to start understanding the challenges, requirements, and start the co-creation of a solution and discussing with the healthcare organization about the tax to be allocated to the follower SME. So we will have to work with the healthcare organization and the follower SME. As for the FTP call, as I just mentioned, we will launch this call in March, so it will last 2 months. So we'll hopefully we will launch it at the end of March to the end of May, and this process will be, so we will, through this process we will be looking for the second SME, so the follower SME. And you will have to, your responsibility here will be to set the plan and the task to allocate it to the follower SME. So you will have to decide together with the healthcare organization what will be the task that the follower SME will be performing in the co-creation process. You will have also to disseminate the call and engage applicants for this call. In terms of the pilot deployment, it will last 12 months from September 2024 until August 2025. So this we will have at the end one team, a pair of 2 SMEs that they will be piloting their TRL in a TRL 667 within the healthcare organization under a real environment. So this is the final composition of the team. And the ecosystem supporter will be also providing business support services during the co-creation process. Next. Well, the main points that you have to consider, the main aspect regarding the expression of interest for the leading SMEs is that if you have a proposal, you will have to submit it by 16 February. You will get, as I will mention later, you will get the 60% of this budget. So you will have to propose your proposal will have a budget of 81,320 euros to be reimbursed in the 60% by the European Commission. As for the awarded applicants, we will select 10 SMEs, 1 per talent. So as Miriam mentioned, we have 10 talents, 2 challenges per healthcare organization. And they will be grant beneficiaries with all the related rights and obligations as project partners. Next. Who can express interest? The eligibility criteria is in terms of the type of organization. We are searching for small and medium-sized enterprises, SMEs, but it's not completely mandatory. So other type of organization can apply, but we will prioritize those as SMEs, and if they are above the threshold, we will try to prioritize them, but they are not, it's not a compulsory eligibility criteria. As for the geography, they must be located within the same country as the healthcare organization proposing the need. So they have been from Spain, Portugal, Slovenia, Croatia, and Netherlands. So they have to be at least from the same country than the healthcare organization proposing the need, but we will be also prioritizing those from the same regions as from the HealthChain consortium. Next, please. Budget. As for the budget of the leading SME, can you please next slide, Miriam, please? Okay, thank you. The project, as you know, as I just mentioned, is co-funded by the European Commission. So this means that the beneficiary have to propose a budget cost of 81,320 euros, and they will be reimbursed the 60% of the budget. So this means that the beneficiary will get in their bank account a budget of 56,924 euros. So this is the budget that you will receive to cover all the cost. Next. In terms of selection and evaluation of the leading SMEs, we will assess the excellence of the proposal in a 20%. So we are looking for ambitious proposal and with a high innovation potential. So it will be really appreciated. As for the alignment, for sure, it is compulsory criteria. They will be aligned with the challenge proposed. So it's in a 25% assessed. In terms of implementation and value for money, this is the 25% score. And we are looking for, so the proposal should have a realistic implementation plan and piloting plan, and also the budgets should be well divided in the among the different phases of the pilot. And finally, for the exploitation commitment, and exploitation commitment, we are also looking for proposal that we for SMEs that will be committed to exploit and get impactful after the and beyond the project in a 20%. Next. And how to express interest. So you have to access the HealthChain website. So we will send you this presentation after the webinar. So we will have the link to access the landing page devoted to this expression of interest. So we will you will have to download the proposal templates. Everything, all the documentation kit is available there. So you have to download the proposal templates and the simplified budget. So we have prepared for you an Excel file with the budget breakdown, so you can include your proposal budget there. And then you will have to go to the online form. It is preparing the EU survey platform, and you will have to submit before the deadline your proposal and the budgets allocated. Next. In terms of the timeline, as you know, the call for expression of interest to look for SMEs is open until the 16th of February. Then we will be selecting the winning solution, the winning SMEs in March 2024, and then the co-creation process will start in September 2024. As I mentioned before, the FTP call for the follower to recruit the follower SME will be launched in March, so it will last 2 months, and we will select the winning solution in June. So the co-creation process will start on September 2024, and meanwhile, the healthcare organization and the leading SME can start discussing about the task to be allocated for the follower SMEs. Next. In terms of communication of results, this is a tentative calendar, as you can see. So we will, hopefully we will communicate the leading SMEs in March 2024. Then they will have to sign the grant agreement with the HealthChain project between March and April, and then the follower SME, once selected, they will be signing the sub grant agreement in July, between July August 2024. Then, as I just mentioned in my previous slide, the pilot action plan will be signed by the third parties in September 24 to start the co-creation process. Next. Okay, so now it's time to go straight to the challenge. Thank you very much.
Thank you very much, Maria, for your presentation. I know it's a little bit complex, the fact that we are launching this expression of interest for the leading SMEs, and we are also talking about the followers SMEs. They are two complete different calls. So what you have to pay attention to is the expression of interest for the leading SMEs, but you need to know that you are going to be working with the other companies that we are going to select after we select you. Okay. If you have any question, we have the section right at the end of the webinar to clarify any doubt that you may have. Okay, so now we are going to move into the presentation of the 10 challenges. They are going to be presented by the healthcare or the healthcare organization representatives, partners of the HealthChain. We are going to start with Murcia, Spain, and I leave the floor to Gorka Sanchez to introduce both challenges.
Thank you, Miriam. My name is Gorka Sanchez. I am a physician. I am responsible for innovation in the Servicio Murciano de Salud, the healthcare organization at Murcia Ecosystem. I am going to briefly present our two challenges selected in Murcia. The first one is PASPADOC. The objective of PASPADOC is to offer to the patients who are suffering chronic pain a comprehensive care plan as a common approach, regardless of the different diseases that cause the pain, in order to ensure training and follow-up, empower the patient, and avoid the current and only approach based on providing medication, referrals, or complementary tests. And our second challenge from Murcia is called Key Control. Key Control's challenge is to apply a solution capable of non-invasively monitoring the potassium level of patients on dialysis. In parallel, the solution must give personalized recommendations to patients to improve adherence to the low potassium diet. The intended result is to reduce the incidence of complications related to hyperkalemia. So if you are a Spanish company and are interested in one of these two challenges, please feel free to join the specific webinar on Wednesday, January 31st. See you soon. Thank you.
Thank you very much, Gorka, especially to address both challenges in quite a specific way. Just a heads up, all the regional webinars are going to be in local language. So in Murcia is going to be in Spanish, in Centro is going to be in Portuguese, and so on. And now we move into the presentation for the challenges from Centro in Portugal. And I leave the floor to Patricia.
Hi, Miriam. Thank you for introducing this. Well, here in Portugal, we in the hospital identify this after we have a period of applications that we receive more than 20 challenges from our hospitals and our healthcare professionals. We select these two challenges to address for this HealthChain project. One of them is Reabilitar Mente, is related with cognitive rehabilitation, and the other one is Recomed, which is related with the therapeutic reconciliation. And regarding this, we have an explain webinar taking place on 2nd of February. Well, and we have here the register form to attend. We are able to answer all the doubts that maybe came in. And so that's it.
Thank you very much, Patricia, also for going straight to the point. Also, we are going to provide the whole list of the registration links for the different webinars. So now we move into our third. So now we move on to our third regional presentation. This is from Western Slovenia, in Slovenia. So Bojko, the floor is yours.
Hello, everybody. Do you hear me?
Yes, we do.
Okay, we have two challenges. The first challenge is called HiPro. The second challenge is called MiPro. The first challenge addresses self-assessment of hip function after fast-track surgery. It is based on Harris hip score, which is evaluated PRO, so-called patient-related outcome. And we would like to put this Harris hip score into user-friendly application on mobile phones. The second challenge is MiPro. It also addresses patient-related outcomes, but it is dealing with mental distress. It is based on HiPro, on evaluated PRO, or patient-related outcome, which is based on paper questionnaires, and we would like to put also this MiPro into an application that is user-friendly and is also based on mobile devices, of course, mobile phone or similar device. This is it.
Thank you very much, Boyko. Just to remind you that the webinar from Western Slovenia will take part on the 2nd February between 10 and 11. And as I said, we will provide the links for the registration.
Okay, may I ask
yes?
just an additional question for this webinar? Technically, who will be the host? You will be the host for Zoom.
Yeah, we will organize that. Do not worry.
Okay,
we will discuss that. Okay.
Okay.
So the fourth region from the HealthChain project is Primorsko-Goranska in Croatia. And now I leave the floor to Theodora to present their challenges.
Hello, Miriam. Hello, everybody. Well, I'm cardiologist in Clinical Hospital Center Rijeka, and this is the main hospital in Primorsko-Goranska County that is very specific, a lot of islands, North Adriatic, and a lot of hills in Goranska County. So we want to facilitate communication with specialist cardiologists to the family doctors and to our patients. In the way that remote telemedicine technology could help us is to prevent deterioration of the patients with any heart disease, especially heart failure, to be near the specialist with the consultations and with therapy, and to make life for those patients and easier, and to improve their access to timely and expert consults from the cardiologist in the clinic. This is the one way of our challenge that we would like to make better and to do, and that is the name Medilink. And the other one is Fall Predict. We know that our patients on the cardiology clinics are usually old and frail, but they want to do walking and taking care by themselves. So to predict if they are prone to falling or something like that, we want to have some sensors to track changes in postural movement and to prevent falling and having some things that are not good for the patients that are walking and taking care by themselves in the clinic. So thank you very much.
Thank you very much, Theodora. So the webinar to further explain these challenges will take place the next 31st January from 10 to 11. And I'm sure that they can provide more information on concrete aspects of the challenges.
Yes,
so now we are moving into our fifth region. This is East Netherlands, in the Netherlands, and I leave the floor to Luz. So Luz, the floor is yours.
Thank you very much, Miriam. Hi, everybody. My name is Luz Haremeel, and I'm the project manager at the Innovation and Healthcare Transformation Department at the Rijnstate Hospital. So these are our two challenges. The first one, DigiCare Aware, is all about creating more awareness about telemonitoring in order to further scale it up. So in Rijnstate, we already have telemonitoring implemented. So that means that patients can be monitored at the home situation and don't have to come to the hospital physically as often as they did before. And we are increasing the number of care pathways for which telemonitoring can be used. But now we're at the point that we really need to make sure that the majority of the healthcare professionals become aware of the necessity of this new kind of care, which is necessary for the future, and also about the possibilities for this, for both telemonitoring and our department, the Virtual Care Center, which are the specialized nurses that perform the telemonitoring. So this challenge is all about how can we encourage a large group of healthcare professionals to become aware and start using the telemonitoring. Difficulty to scale up can be a variety of reasons, but we need a solution that can be creative, but it should be adapted to the environment. So it should be adapted to an audience of healthcare professionals who have a high workload, who have different roles and different levels of knowledge and skills. And then the second one is all about increasing patient self-management. It is important to further make the healthcare future-proof, to reduce unnecessary care demand and increase patients' own self-management. We already have an important aspect of that is to promote healthy lifestyle. We already have various methods of lifestyle support. But what we lack is a way to determine the right extent of lifestyle support that a patient needs. So, for example, one patient might only need a hyperlink to a website of information, while another one needs a full coaching program. So we really need to find a way to efficiently determine what level of lifestyle support a patient needs. So that's it. So if you are interested and you're a Dutch company, then please join our webinar at the 30th of January. Thank you.
Thank you very much. So now you have listened the 10 challenges that we are working in HealthChain project, and I hope they have been of your interest. So now we are going to focus on which are the next steps that we need to follow. So the first thing is, please go, if you are interested on the expression of interest, go to our website, the HealthChain website, and go through the expression of interest documents. We know reading takes time, but honestly, all the information, we have tried to do our best effort to gather all the information within those documents. In case that you have any questions, you can contact the project coordinator. There you have our emails. So please send us an email with your question, and we will try to answer as soon as possible. If you have any concrete question on the concrete challenge, also address that to us, and we will contact the HealthChain healthcare organizations in order to provide an answer as soon as possible. Then fill in your proposal with the template provider. Please check that you are able to fill in the proposal before, like the day before submitting it, just to make sure that everything works. We don't want to have like problems with the deadline, and the deadline will be the 16th February 2024. So that's really the next step that you have to focus. And now we are going to leave the floor to the audience just to answer the questions that you may have, and that needs some clarification from our side. You can use, as I said, the Q&A box, but you can also raise your hand, and we will open your micro for your question. There's already one question here, and Elena, you might be able to answer that. Is the budget for the budget that we have mentioned for the whole project until August 2025, or just for the first co-creation phase, like February, March 2024?
Thank you, Miriam. Yes, I can get that. So it's the budget for the whole period, but the work of the SME selected will be only concentrated in the co-creation with the healthcare organization. So my colleague Maria also presented that you will participate in the evaluation of the second SME, but that's just for your interest, because you may want to make the decision of who is onboarding, your consortium with the healthcare organization to be part of the co-creation. But other than that, that will be your only work, the co-creation and selecting the second SME together with the healthcare organization, of course. I hope I replied your question, but if I didn't, please feel free to follow up in the Q&A box.
Also to say that although the companies selected are going to become full partners of the HealthChain project, we understand that they have been selected for the co-creation process, as Elena mentioned. So we are not going to request additional workload from your side in different activities in HealthChain. So that means that we are not going to ask you to attend all the consortium meeting. If you want to, you are more than welcome. But the workload that it is going to be related to you, it is the one that you are going to include in your proposal. Okay, so we will limit that. We will leave it open if you want to, but we will also restrict it to your proposal. I don't see any other question. I don't know if it is because it is really clear or because you still need to go through the question and answer, or maybe there are concrete questions that you want to go through the regional webinars. In any case, as I said, our mails are at your disposal for you to let us know if you have any question, and you can address to us anytime before the deadline, of course, and we'll be more than happy to provide information. There's another question. Yeah, okay, it's not a question. It was more like a thinking. So as we said, recording will be available for everyone. We will also provide the presentation as well as the links that have already been provided through the chat box to the respective regional webinars. And we will really, if we are from Spain, can we participate in projects of another countries or just Spain? Okay, I'm going to answer this, Elena. If you are from Spain, for this concrete call, you can only participate in the challenges that are from your country. In this case, Murcia. So if you are from Spain, you can only participate in the ones from Murcia. But we are going to launch another call that is the one that we mentioned as following SMEs. And on that one, you can participate in all the challenges, but the ones from your country. Okay, so you will be able to participate in the challenges proposed by from the Netherlands, from Primorsko-Goranska, from Western Slovenia, from Central, but not from Spain. So if you are interested in the other challenges, wait for the next call that is going to be published, but has different conditions. Okay. Perfect. I don't see. Okay, there's one question now. It's like, who selects the follower SMEs in terms of IP? How to handle these two SMEs? Okay, the follower SMEs will be selected by the HealthChain consortium, mainly the healthcare organizations. So we will set an evaluation team, and we will follow a similar procedure than the one for the selection of the SMEs, the leading SMEs. In terms of IP, we will set meetings just to see how the IP is managed between the lead SME. So we will include some conditions or some potential conditions, mainly from the healthcare organizations, but we will open also a negotiation period before signing the contract.
If I may add to this, Miriam, yeah. Thank you very much. Of course, I mean, the healthcare organization is the end user and the potential customer of the solution. So that's why they take care of the evaluation. But of course, the leading SME will also have a say. Think that by the time we select the follower SME, the leading SME, so the one selected through this call, will be already onboarded in the project. So you will be partners and you will be able to discuss which kind of work you leave to the follower SME, and to make a first proposal on how this IP will be managed between both of you. Of course, the follower SME needs to agree on, but let's say that you will have an advantage because you would be already on board on the project. And in this sense, I see another potential advantage, that is that if you already have a solution in a high TRL or medium TRL, technology readiness level, and you need to fine-tune it with specific features that you don't have the capacity to develop. It's a great opportunity to leave it open to another SME to help you to improve those, if you know what I mean. So that's it for me. But if you want to follow up on the question, again, I'm happy to answer. I see Diana has the hand raised, so
yeah,
she would like to
open her micro.
Open her microphone.
Mm-hmm.
Okay, so now you should be able to open your microphone, Viviana.
Hi there. Thank you for the clarification. I think it's probably faster if I talk instead of writing. From my understanding, so basically there is a leader SME that comes in with a solution that supposedly needs to be already at a very high TRL, at least 6. That's already a pretty mature solution. So in terms of like adding another follower SME, in terms of development is very hard because of IP. We're not going to be putting people working in our code, if you know what I mean. So is there different ways that we can add the SME more, for example, in the part of the implementation in the hospital rather than in the technology?
Yes, that's possible. In addition, you could even, for instance, think of integration. If you are not integration expert on the hospital, would like to have it integrated within their systems. That's something that the follower SME could do as well. In any case, you will have to limit that if you are awarded as a leading SME together with the healthcare organization, so that when we launch the call to the follower SME, you really make clear which part is to be solved by that follower SME.
So kind of the second, the follower SME will have a challenge of their own so that they can apply.
Related to the challenge that is now described, but
yeah, it's like a sub challenge, let's say.
Okay.
No, the challenge is big, so it's going to be a split. Yes.
Thank you very much. It was very clear.
No problem. Thank you.
Boyko, you had your hand raised.
Sorry, I lowered the hand, so no additional questions.
Okay, perfect. If there's no other question, we will close this webinar. We thank you very much for the interest, and I hope that we will be receiving proposals and that you can join to the regional webinars to know more about the different challenges. So thank you very much.
Thank you.
Thank you.
Bye-bye.
Thank you.
Bye.
Thank you. Bye.